Hi, I'm Dr. Todd Molnar from the Southern California Orthopedic Institute. My specialty is physical medicine and rehabilitation, which includes expertise in performing epidural spinal injections. Many refer to these just as epidurals or epidural blocks, but there are different types of epidural procedures. Most are familiar with epidural anesthesia, which is commonly used during labor and delivery to numb the pelvis area to allow for a more painless delivery. Those are very different than what we use here to treat spinal conditions. Epidural spinal injections are used when there is severe pain in the neck or back that also might involve a pinched nerve with pain radiating down the arm or leg, possibly including numbness or tingling. The patient will typically have an MRI and nerve testing to determine where the problem is arising from in order to accurately plan out where the injection should be done. The purpose of the injection is to precisely place medication using a steroid combined with an anesthetic into the epidural space in the spine. The epidural space is located in the spine behind the disc, right here behind the disc. When the disc herniates or the spine is too narrowed, the nerves may become pinched, and they become pinched right here in the spine. When they're compressed, they become swollen and even damaged. There is usually a massive inflammatory reaction that causes this reaction and the pain. Steroids are the most potent medication available to quell the inflammatory reaction and speed up the healing of these inflamed nerves. The anesthetic is used to temporarily relieve the pain, but will only last for several hours. The term epidural block refers to the concept of blocking the pain with anesthetic, which can be helpful in confirming the diagnosis. However, it is the steroid that gives the more long-acting effect and actually treats the problem. The injection is performed in an outpatient surgery center in the operating room using a live X-ray machine. After the patient is brought to the pre-op area, an IV is placed. An anesthesiologist will meet with the patient to discuss sedation. Once brought into the OR, the anesthesiologist will give the patient twilight type of sedation while I sterilely prep the area. This helps keep the patient comfortable and still during the procedure. Once sedated, the skin is anesthetized using a local, then a spinal epidural needle is inserted while visualized on the live X-ray machine. A small amount of dye is injected into the spine, and then we can see exactly where the combination of the steroid and the anesthetic is injected, and a Band-Aid is then placed. The procedure only takes several minutes. The patient is then observed for 30 minutes in recovery and then sent home. We usually recommend 1 week of avoidance of strenuous activity while awaiting improvement after the epidural. Some patients may note relief immediately, while many take several days to even up to a week to see relief. There are times when the nerve may be reactive to having the procedure and might even flare up for 1 to 3 days with a temporary increase in symptoms. This does not indicate that something went wrong, just a very sensitive nerve that will typically calm down and then ultimately improve. The other risk of having an epidural is a spinal headache. This only occurs if the needle is inadvertently punctured into the thin lining around the sac that surrounds the nerve, and that's where the spinal fluid is. This is the same effect when a patient has a spinal tap. It is not dangerous and will usually resolve in a few days. The headache is only present while standing up and is relieved by lying flat. In my experience, this only occurs in less than 1 in 1,000 patients. Many patients ask, how long does an epidural injection last? The real question is whether a given injection will work or not. If we see a beneficial response, then we typically will recommend a proper rehab program to start 1 week after the injection. Each patient is different and is managed on an individual basis. Some will have either a partial response or the symptoms may recur, at which time we may recommend repeating the injection. Usually we allow for no more than 3 injections in the same area per year. I hope this helps any questions you have regarding epidural steroid injections. Thank you for your attention.